current research interests are primarily schizophrenic patients in the community and type 2 diabetes.
My research interest is parent-adolescent sex communication.
My interests have been surrounding issues related to how hospital structures or institutional structures influence quality reporting cultures.
Several women in my family that have hypertension, and when I worked in the ICU, I saw that a lot. So I decided to come back and try to do something about it.
I am studying basic sciences, looking at genetic aspects of pain. I like being at the bench, doing the actual science, and I think it's just being able to see the whole picture all the way across.
When I had heard about the Doctor of Nursing practice, I was immediately drawn to it because it was a new program, new opportunity to expand practice, and I was really intrigued by the flexibility in the schedule. I could still keep my full-time position with the county and continue going to school full-time.
When I came here, I left my job. Luckily, being here, I found a position as a graduate student research assistant, so I work my 20 hours a week in the lab, and that helps pay for my tuition, my living expenses, gives me insurance.
I worked in ICU most of the time, and then I worked for an insurance company for 1 year, but I really felt like I wasn't letting my light shine, so I decided to come back.
I would say a DNP is a great choice for anybody looking to go beyond hands-on clinical work. Well, being able to stay in contact with my classmates and my professors in a non-campus setting was really nice. We had a lot of web-blended activities, phone conferences, online web chats, things that you can pretty much access from anywhere.
You can do so much with a PhD, and that is shown by the staff and faculty that are already here. I mean, you could be a dean, you could be a professor, you could be a nurse scientist, you could be a director of a center, you could work at a nonprofit. I mean, there's just so many things to pick from.
Seeing patients actually lose weight and make changes that improve their health that are based on the recommendations that I was able to make for them, really for me is the reward.
Nursing has many opportunities in it. There's lots of doors that can be open, and I think the opportunities are growing with increased demand for healthcare.
Access to care is always a struggle, and really identifying the barriers and working as a team to overcome some of those barriers and address some of the issues and the disparities that those clients experience is very fulfilling.
Funny, I was in class the other day, and one of my friends who's a postdoc here in, I think, health policy and social work, she said, when I need to know something about healthcare, I always go to the nursing literature because the nurses are involved in all kinds of different aspects of research.
They graduate great nurses, and that's the expectation of Michigan, to be the leader and the best. And so whenever you go into a facility, I can identify a Michigan nurse in a second versus versus a person that came from a different institution. It's just what they teach you. It's just who you are.
When we need more doctoral prepared nurses, we need more leaders and scientists to help us move nursing science forward.